Welcome to the Bringing Intimacy Back show, where intimacy is real. If you desire to intimately connect with yourself, significant other, children, family, friends, community, and higher power, then this is the show for you. We explore intimate topics, inspiring life stories, spirituality, and insightful tips on strengthening relationships. The show is hosted by Dr. April and her co-host, Coach K. Let's get this episode of the Bringing Intimacy Back show started. We share with you today the secret power to intimacy to create the life you love or love the life you create. Now here's your host, Dr. April, and her co-host, Coach K.
Welcome to the Bringing Intimacy Back show, where intimacy is real. Yes. Well, welcome, Coach K. Your microphone is okay. How are you doing?
I'm doing great. I've been here. Another amazing day. How about yourself?
Oh, I'm doing good. Yes. Even though we just overcame another hurricane here in the state of Florida, but I'm thankful that all the people I know are safe, and I know that there are people out there who are struggling. And I want to, give my heart and thoughts and prayers out for them, because it is difficult every year. We have a storm that comes through, but it's part of life. And of course, we're not out of hurricane season yet. So.
Absolutely. And I am glad because I saw it. My daughter and my niece for her birthday went to Puerto Rico. And that's when I first, because I'm checking the flights and I was like, it was coming right above kind of where you guys are. So I'm glad to hear that kind of a repeat of just last year did not happen.
Right. And as you know, with everything, nothing really repeats the same.
Yeah.
Yes. But we're always sometimes scarified or terrified by it, or becomes trauma.
Absolutely.
Yes. And in the sense of trauma, one of the things I know you and I do and help people with is sex.
Yes, indeed.
Yeah. And sometimes, I don't know, I've seen quite a few where people are traumatized by sex for a variety of different reasons. But one reason that I see is pain.
Yeah. And a lot of times in that same, people don't talk about it because for whatever reason, so many, especially women, so many of us think that, pain is normal because of their size or the position, and it's not addressed.
Right. Yeah. It's because it's like, it's not supposed to be painful. So I'm just not going to say anything, and I'm just going to shut up and just let it happen to me.
Mm-hmm.
And so I'm so glad that we're talking about this topic today. It's overcoming sexual pain.
Yes, this is a super important topic to talk about.
Yes. And we have an expert, a pelvic floor specialist, Mary Grimberg, who's going to enlighten us about what do we do when we have that and feel that, because besides, you got to always listen to your body.
Yeah, our body doesn't lie. Now, we try to make it seem like it's a lie, but your body will not lie to you.
That's true. Yeah. And I think it's just because we're not taught early in life, hey, that we should take care of our body and we should listen to it. And there's resources out there.
Mm-hmm. Well, we also try to control everything. So there's that.
Yes. But we can't control everything. And when things are hurting, there's resources out there. And just because we always talk about a charity of the month, the charity for this month here is bettertomorrow.org, which is a great organization. So if you're overcoming adversity and you have things that are happening, definitely check out this thing, because it's a charity of the month that helps people overcome tragedies such as the hurricane and a variety of other stuff. bettertomorrow.org. Definitely check it out.
I love it.
Yes, definitely. And so if you're out there listening and you're like, what are we talking about today? We are going to talk about how do you overcome the pain that happens when you're trying to have sex or wanting to have sex. What do you do? What kind of Do you just take it? Is it a myth? No, it's not a myth. If your body's saying that you're in pain, you're in pain.
Yeah, I'm excited about this. And I'm more excited that we have a pelvic floor specialist, because there are not enough people that know that everything doesn't go to just the OB or PCP. Pelvic floor specialists are special. So I'm glad we have her on.
Yes, and if you're out there listening saying, what is a pelvic floor specialist? Well, stay tuned. We'll be back in a moment and we'll explain it all to you.
Cape Coral Therapist wants you. We are looking for a registered intern in mental health or family and marriage. Are you looking to start your own practice? Are you able to work in the Cape Coral office? Are you willing to work with men, teens, addiction, and relationships? And if you're bilingual, it's a plus. If the answer to all these questions are yes, then send your resume to info@draprilbrown.com or call 239-565-6921 for more information.
Welcome back to the Bringing Intimacy Show, where intimacy is real. Welcome, Dr. Mary Grimberg.
Hi, thank you guys so much for having me. I'm excited to be here.
Yes, we're so excited that you're here because, like Coach K says, there's not that many of you guys out there, and to have one in the show is, it's like a treat.
Yes.
Okay, thank you guys. But I appreciate that. And yeah, there's a huge need for pelvic floor physical therapists. And what's crazy is that so many people are unaware that we exist. And like you guys were saying, I mean, people are pushing through pain because they think, oh, this is normal, right? And even myself, in the past, prior to being a pelvic floor PT, I have had pain with sex, and the response I got was, oh, it's just endometriosis. And I was like, so that's it? You know, that's it. Okay. So what's the treatment for that? Well, we don't even know if you actually have it. So we'd have to do a laparoscopic surgery to see if you have it. And then we can remove it when it's in there. But then how do we know that that's what caused my pain? Right. But so I think that, you know, what you guys are doing here is great, because spreading this information is vital, because women over and over have been gaslit into thinking that their symptoms aren't real. I mean, I've had it going to different doctors and different things, and I'm here to validate all of those feelings that you've had where you might have felt like something is wrong, but you were told, oh, just kind of deal with it, you know?
Right. So before we get into the nuts and bolts of it, please tell everyone, what does a pelvic floor physical therapist actually do?
Yeah, so I'm an orthopedic and pelvic floor physical therapist. So basically, I have my doctor in physical therapy, and then you can go into different specialties kind of based on your training after school and like what clinicals you went to. But in the physical therapy realm, you have to do additional training outside of school. School doesn't necessarily teach this, hopefully yet. They will in the future, hopefully. And so there's additional training that goes into that aspect. And so I have the orthopedic background where I've learned how the body moves, understanding how everything is connected. And then I've been able to apply that to pelvic floor physical therapy and looking at it from an overall big picture. But a pelvic floor physical therapist generally works with helping people with pain with sex, pain with penetrative sex, pain with orgasms. It can be vaginal pain. It can be pelvic pain. It can be pelvic organ prolapse. So we'll help with that. And just accidentally peeing yourself, accidentally pooping yourself, accidentally farting, all the fun taboo topics that I love to talk about. And so just really helping people from that perspective. And so we'll assess that the pelvic floor is shaped like a bowl, and then you have your pelvic organs in that bowl on top of that. So you've got your bladder, uterus, and vagina, uterus, and rectum. So on top of that are your pelvic organs. And so typically a pelvic floor physical therapist will ask you a lot of OB related questions. So, hey, did you have a vaginal birth? You know, sometimes and then talking about the birth and what happened there and understanding that. And then there's this misconception that we only treat postpartum people, which is not the case at all. It can be people that have just started having penetrative sex, right? And so I'll look at people's, typically like a pelvic floor assessment, if somebody's comfortable with it, would be kind of looking at the entire body, how they're moving, hip mobility, things like that. And then there is an internal assessment, and some people can opt out of that too. But the first part of it is external. So I look at the vaginal tissues, looking at the labia minora majora, looking at the tissues around the vaginal opening. What color are the tissues? Are they white? Are they more pale? As we start losing estrogen, the tissue becomes a bit more of a lighter color compared to the rest of the vulva. And so you can kind of see some of these changes as well. And then the internal assessment is having people bear down and seeing if we have any prolapse. So that's usually it's a bladder or rectum kind of falling out of the vagina. And then an internal part where I'd assess the muscles and kind of see where they're tight, where they're having their symptoms, and have them contract and relax, and seeing if they have the ability to pull up, push down, how long can they hold for. So all of that gives me a lot of information. I know that's a long way to explain it, but if I just said, oh, I treat these things, people are like, well, what does that mean? So I tend to dive in deeper to give that understanding, if that makes sense.
Mm. Yeah. So
that is a very good explanation.
Yeah. What I was hearing, that sexual pain can be of a variety of different reasons.
Oh, so many. Even if it's non-penetrative sex, there can be pain. There can be pain with orgasms before, like during or after. So that can happen as well.
Right. And what I'm also hearing, it's not, if you have pain, it's not, necessarily your fault. People think, oh my gosh, I must have done something wrong or this or that, but it could be hormonal. It could be a variety of different things, the bladder, or a lot of different things that could have caused it, hereditary. Yeah.
Totally. And the biggest thing I try to emphasize to people is you're normal, right? Like, we just have to figure out what is going on. There's nothing wrong with you. You didn't do anything wrong. Our system did you wrong, right? Like, understanding our bodies. We weren't taught these things, right? And so it's teaching women and people with vulvas how to get back to their bodies and understand and kind of take away some of that shame and guilt of not knowing, right? Like, oh, there's something wrong with me. And, the old school mentality of like, oh, to please my partner. It's like, well, what about pleasing yourself?
Right.
Especially in heterosexual relationships and stuff, there's a lot more of guilt of, oh my God, I can't please my partner. It's like, okay, I get what you're saying, but also this is you, and you're experiencing pain and you're not experiencing pleasure. So how can we shift that to get you both to enjoy this? And, and not just kind of bear through the pain. Because then what that does is that it creates this, pain cycle where then you start fearing sex because of pain. And so then we have to work on undoing that too. So it's a very sexual pain is a multifactorial thing, right? Like, we need your all's help, physical therapist, and even sometimes with OBGYNs and urogynecologists, we all need to be working together, because it's not like a one size kind of fits all diagnosis, if that makes sense.
Yeah, I was kind of thinking how you even started
and
this.
I think it's also important to note about, because sometimes it's not pain I'm sorry. I know it's sometimes not pain like every single time someone has intercourse, and it could be like intermittent pain. So I think it's just also important to say that if there is any pain, maybe even more than once, to maybe, if the GYN says, I didn't find anything, medically, to reach out to a pelvic floor physical therapist. And I like to say that so people understand, physical therapist, meaning that we may need to work yourself back to a place. Don't just change positions. See what's going on in there.
Yeah. I mean, it can be one of those things too, like certain positions can be painful, or maybe it's a position you want to do, but you can't do because it hurts. Or maybe it only hurts on certain days, or maybe it hurts with initial penetration, not deep, or if it's deep penetration, but not initial, right? And so when I start asking people these questions, they're like, oh my gosh, I didn't even know there was a difference. And I say, yes, there's a lot of stuff to kind of unpack there, but generally speaking, any pain is not normal, right? And so if you're consistently having it, even if it's every now and again, what can we do? What can we address to see what is going on? Because, yeah, you can go to your OB and they say you look fine, right? They're looking at it from a structural standpoint. Okay, cervix looks good, like maybe a little prolapse, tissues look fine. Okay, right? And so from a musculoskeletal standpoint, I want to know, well, why are they experiencing these symptoms? Like what's going on? And so with overcoming sexual pain, I mean, there's a whole variety of things, but I can kind of go into some, I go through some of the questions that you guys have, and diving into it that way, but just understanding that there is a lot that, that you can do. And also what like Coach K, you were saying, there's not a lot of pelvic floor PTs. And in the pelvic floor world, we need more time one-to-one with our patients. And a lot of pelvic floor physical therapists do not take insurance, which can be detrimental. It can be hard, right? I'll be blatantly honest. I don't take it because it is so hard to keep a business up and running, taking insurance from a PT side of things. And so that was one of the reasons I started my podcast, to help with people to have access to information that they wouldn't have had, and even take the money part out of it, distance, location, things like that, knowing somebody that, can provide these services. So there's multiple barriers that can limit people's access to this. And so that's why I'm excited to be on your show, so people can learn these things and then start doing their own understanding of what is going on, just versus feeling like they're broken.
Wow. Yeah, so Dr. Grimberg, I was in supervision with some of my therapists, and one question came out about a client who had, I think she had a baby abortion, and she had sexual pain. And she went to the doctor and went to the OB, and they said everything's fine. Yes. So, and I'm hearing from you that you don't take insurance. So how do you get from OB, and sometimes they don't even mention you guys?
Oh, they do. Yeah. I mean, we're in Austin, so we're starting to build like a pretty big pelvic health network here.
Right.
But you would have to ask. The reality is you might need a referral from your doctor, and then whoever they know. There's also a website called thepelvicguru.com, and you can look up different pelvic floor physical therapists around, and you can call them directly and be like, hey, what do I need from my doctor? Or can I just come in?
Can you, in most places, can you just come in?
Well, you'd have to call and see.
Probably make an appointment. Everybody,
look at my vulva. I'm just like, no, I can't do 20 people today.
I mean,
but yeah, you could. I would just call and just say, hey, because every state's so different. Like in Texas, you need a PT referral regardless if you're in network or out of network with insurance.
Wow.
And so there's that aspect, but they can still come straight to me. I'll work with their doctor to get the referral, but other states are pretty progressive in that sense. Just Texas is a bit slower for a lot of things, which I could go on and on about, but I won't. And so anyways, so I would call pelvicguru.com is typically, you can look at their directory and see anybody nearby or even in your state. So you could do a telehealth with them and reach out and see, what services they offer and what you would need. So I would start there in that perspective. And yeah, so.
Okay. Yes. And so in the sense of a pelvic, how long are sessions? And
It depends on the person. Like if you have an extensive history, sometimes people will do 90 minutes. But most people are about 60. And then again, it just depends on cost. I try to get people better within 4 to 8 sessions, just to kind of help people financially and time-wise, because I know time is actually sometimes more of a factor than finances are for people. It just depends. And so I try to teach people about their bodies so they can get better faster. And so if they need a little bit more time, they can do the 90 minutes, but most of them are about 60. And then if in network, sometimes they're 30 minutes or 45 minutes. It just depends.
Okay. And if you have sexual pain and you don't take care of it over time,
over time, I feel like it's, sexual pain over time, it's more reinforcing that pain cycle. So then you start developing a negative relationship with sex, right? Because then you start fearing it. It would be like if you, every time you went to go running and you stubbed your toe every time and you're just like, okay, I'm going to stop. Like, I'm not even enjoying this anymore because I know the pain afterwards, right? Mm-hmm. And so it's more of that would be of a concern. And then, yeah, just the lack of joy and enjoyment. I mean, the amount of women that do not enjoy sex it's a lot, and we're allowed to enjoy it. Right. We are allowed to be sexual. And I think sometimes tapping into purity culture and undoing that, even though regardless of whatever people's religions are, any fear-based stuff into our bodies can affect somebody and how they perceive themselves sexually too. Mm-hmm. And so how can we kind of nurture all of that together, but then teach someone, hey, you can enjoy sex. This can be fun. This can be playful. And learning to communicate with your partner. I find that in heterosexual relationships, the communication around sex just goes plummets. Like it is normal in our culture to have no conversations about it versus actually open and being like, hey, I enjoy this. I enjoy that. I'll sometimes like tell people, explore your body yourself and see what you like. Because with sexual pain, like the person that you were discussing, I mean, so 2 pregnancies and 2 abortions, what type of births did they have? When did their pain, I would want to know, when did their pain start?
Right.
Is it pain with initial penetration? Because initial penetration is different. So you've got the dermatological aspects. You've got changes in that tissue color. So if it's a lighter color, and it looks a little irritated and red and things like that, that can be painful.
Right.
And that can be for a variety of reasons. That can be due to impaired vaginal pH. Mm-hmm. So sometimes that can happen due to a decrease in estrogen, right? So with this person, I'd want to know, hey, are they, after their recent pregnancy, how far out are they? If they're breastfeeding or their estrogen changes have not normalized or gone back to their baseline, the tissues become thin and fragile. Mm. And so the pain can almost feel like a tearing or burning. Mm. And that might be something to consider with vaginal estrogen. Or if you don't want to do estrogen, there's hyaluronic acid suppositories that can help with that lubrication. There's sometimes people will put a lubricant on the vaginal opening to help those tissues, right, recover a bit so it doesn't hurt as much. Deep penetration can be pain with deep penetration. So maybe you don't feel pain in certain positions, but you do. And so, for instance, if you are having pain in one position and you try another and you feel okay, it goes back to the anatomy, understanding like what areas are being more irritated in those positions. And so I find a lot of people with pelvic pain, one of the bigger positions they have pain with is there's no doggy style. I think it's funny because there's no medical terms for these sexual, just like, but because I find that sometimes there's pain with that position is the most common one that I'll hear. And I find that the other common reason I find that with that is there's not enough clitoral stimulation prior to penetration. So if we go straight into doggy style, like if you're watching TV or something, like ripping off the clothes and penis and vagina, that is not real. Like that's not reality. And that's just not the way our bodies work. We need that lubrication. We need that genital stimulation. I mean, it can work occasionally, maybe, but the reality is we need that clitoral stimulation, which helps widen the vagina and raise up the uterus, right? So if we have pain in certain positions, like the one I was mentioning, well, was there enough clitoral stimulation, right? Did this person need more arousal to the tissues before penetration? It's hard because there's so many things it could be. Vaginal tearing. Did they tear during their birth and they have scar tissue? Mm-hmm. So that scar tissue doesn't expand like other tissue would, right? And so we need to get that moving. But people aren't told this, and I just went on like a tangent, but I just love explaining all this stuff. But anyways, does that kind of give you some idea about that one particular client you guys had?
Oh, yes. And I was also just thinking, because you're talking about tissues, that many times young women and older women, or women overall, don't really look at themselves.
Mm-mm. They don't.
I have pain. Like if you have pain in your arm, you can actually look at the arm and see, oh my gosh, I see a bump. I see this. I see that. But if you have pain down there, sometimes it's like, I'm not going to look. Or they haven't even looked before, so they don't know what it originally looked like. It looks like now. Yeah.
Exactly. So you don't know what your normal is, and this is why we talk about like, when you go to like the OB and stuff, they're like, hey, are you doing daily breast exams? Because it's like, you might not know what your normal is. Like you might have thicker tissue or whatever it is, and you don't know, but then you feel something and you're like, oh, is that normal or is it not? Because I don't know my baseline. So it's pulling ourselves back into our body. Yeah. Even looking at your vulva, lay down, stick out a mirror, pull your vulva. So pull your labia, those tissues apart so you can see your vaginal opening, right? And at that vaginal opening, we tend to think of it as a clock just for easier navigating. The bottom part of that vaginal opening is closer to the rectum, so the anus. The top part is closer to the clitoris. And so most of the time when I find that dermatological stuff, it's like on the 6 o'clock side, closer to the anus, you spread it and look, is it red? Is it irritated? What color do you see? Right? Because you might be like, I don't even know what I'm looking at. But at least now you know.
Exactly.
You get what I'm saying? Yes. And I'll show people, I'll tell people, I'm like, hold a mirror. Here's a Q-tip. Like when they're in the office, I'm like, this, do you see this? Do you see that? What do you see? And most of the time they can say, oh, I see this. And I'm like, okay, that's right. Somebody the other day, their tissue is more, it was lacking color. It was just becoming more of a palish color or just a few shades lighter. And you can tell it was just different. And it was because of an estrogen deficiency, likely. But it's hard to say exactly what it is until, with that, we have to work with their doctor because I can't prescribe the estrogen. But it's also, is that even what they need right now? So there's different things. But yeah, look at your vulvas. Get a mirror.
Yeah. I didn't know if Coach K had something to say. It seemed like she wanted a question.
Well, I was just going to say, I think it is important that we look at our vaginas, our vulvas, we feel them, touch them, because if you're willing to open them for someone else to enter them, these should be welcome first.
Yes, exactly. Explore your body. How can you communicate what you like in bed if you don't know what you like? And it's okay to explore your body. It's okay to try things. It's okay to try vibration. It's okay to try light touch, firm touch. You know, people will say, how do I even masturbate? I'm like, you'll know, like just move around clockwise, counterclockwise, light touch, deep touch, vibration. Just follow what feels good. Follow what feels good, which is kind of hard, especially as women. We're told to just kind of, you know, push past all that and just bear through it all and don't complain, just in life in general. So for us to actively seek pleasure, it almost can feel kind of guilty.
Mm-hmm.
You know, I haven't been told this before. I was never taught this. I mean, to this day, I haven't had sex ed. It was funny. I was talking to my mom the other day. She's like, I don't think I had the talk with you. I was like, no talk. There's nothing. We're not having it now. Okay.
Yeah. And I was just thinking, as a woman, as we get older, our bodies change. And as you were talking about estrogen, you know, so it may feel good and when you were younger, but then now if your body's changing and you do have pain, some people say, well, just suck it up. It's menopause, or you're getting older. Just stop having sex. You're too old for XYZ.
Close your vagina after 40 is basically what they say.
Right.
Hell, I want to be having great sex until I'm 90, maybe whenever. I don't know. I may, you know, it might be a little bit slower and more fatiguing, but no, I get super frustrated because, you know, I'm a few years from 40 myself, and just hearing the amount of dismissal that women get as they age is unbelievable. Mm-hmm. And sex in your 40s and 50s and 60s can be amazing because you've gone through so much of your life that you're just like, okay, you know, you're less likely to be a people pleaser. You're more of like, hey, this is what I want, you know, and if you don't know, you can explore and you can ask for what you want. But I find it can be very empowering just to have sex, you know, as you age, because you know what you want, and you're, you know, sometimes it just takes practice to know what you want and know how to tell somebody else. But what I say is menopause does not need to be the end all be all of your sexual journey. Mm-hmm. And it can be just understanding, well, what is going on, right? Mm-hmm. Do you have vaginal dryness? Okay. Well, we might need to look into some vaginal estrogen.
Right.
If you don't want to do hormones, there's hyaluronic acid suppositories, right? And so these things help lubricate. The estrogen restores estrogen and normalizes the pH and helps with lubrication and decrease some of that irritation. But if you're not wanting to do that, you can also do, like I said, the hyaluronic acid suppositories. What that does is just help lubricate the vagina, even when you're not having sex, and helps those tissues. Mm-hmm. It's not just bear with it. There's a lot you can do. There's creams that you can put on the vaginal opening that can help with that sensitivity, right? Sometimes people complain that they don't feel their clitoris like they used to. Sometimes that can be due to the estrogen changes as well.
Right.
And so then it's rediscovering, well, what feels good for me post-menopause, right? Mm-hmm. Are different sensations different? Your body's different now.
Yes.
And so trying different things, that vibration goes up a different pathway of the brain than light touch. So maybe we explore different types of vibration. Maybe we explore different, erogenous zones. Like maybe you don't like your nipples touched as much. Maybe you like something else. You're allowed to change your mind. And you're allowed to explore. And, you know, if you want to have fun and try on lingerie or whatever it is, even if it's just with yourself, do it. And I think that the more we can normalize these things and understand that your vagina is not closed after menopause, it's ready for action. You just need to figure out what works for your new body. Because we go through these different changes, right? Like, after you have a child,
right?
There's vaginal changes. After prolonged birth control, oral birth control, that can cause some decrease in estrogen in the vagina. I went through cancer treatment in 2019. I'm fine now, but that can change the tissues as well. It can make them drier, more irritated, change in estrogen there. Perimenopause, menopause, surgeries. any changes to our bodies, right? And so I know the tendency is to be frustrated when you go through menopause. I get it. I know, I might be in perimenopause myself, just from the chemotherapy. But the point is yes, you can mourn that previous part of your body, but also moving forward and figuring out how can I re-explore myself and figure out what works for me again, because I just refuse to let women think that they're not attractive anymore, or they can't be sexual after a certain age, because that's what we've been fed, and it's not true.
Exactly.
Yeah.
Yes. Wow. Well, you've given us so much information. Yes. So how can people find out about you and the resources?
Yeah. So you can find me on Instagram. It's Dr. Mary PT. So Dr. Mary PT on Instagram, Dr. Mary PT. And then I don't know why I just repeated that like 5 times. And then just want to make sure. And then my podcast is called Sex and Wellness with Dr. Mary, where we talk about taboo topics surrounding the pelvic floor. So I have one coming out. It's next week about hemorrhoids, which I'm super excited about. Yeah. So I bring up all those topics. And so it's Sex and Wellness with Dr. Mary on all platforms. And then my my PT practice in Austin, Texas is Resilient RX. So resilient-rx.com. We offer orthopedic and pelvic floor PT. So, oh, look, it popped up right there. I feel fancy.
Yes. Yes. Well, thank you so much for being on the show. Yes. And women out there, if you're in sexual pain, there is a solution. You just need to research and ask questions much more. Yes. And I know you gave a website out about pelvic floor.
Oh, pelvicguru.com. Yeah. Yes. So if you want to find a local PT or somebody in your state that can help, that's a great way to do it. And also, I did do a podcast on pelvic pain, and I dove a lot more into these different types of pain. It's on my podcast. I need to look at the exact episode, but that can also be something that dives a bit more into pH and the different changes and stuff too. So.
Right. Well, thank you so much. You're welcome back anytime.
Oh, thank you.
Thank you.
It was awesome.
Right. Yes. Well, we'll be taking a short break, and we'll be back in a moment.
Join Vacation Counseling on the Christian Couples Retreat, September 13th through the 18th of 2024. Enter into a deeper connection with God and love and honor each other passionately in God's love. Dr. April Brown, intimacy and sex therapist and author of Improving Intimacy, and Dr. Jason Prendergast, therapist on 90 Day Fiancé, Last Resort, will lead you through Christian-based relationship and intimacy therapy, the Gottman Method, temperate therapy, group and private couples counseling, and enjoy intimate vows exchange, dancing, and boating excursions. For more information, call 239-565-6921. Book your Christian couples retreat today at vacationcounseling.com. Ignite the passion in your marriage.
Welcome back to the Bring In Intimacy show, where intimacy is real. That was just a wonderful topic. And I learned so much in the sense of helping individuals who get stuck with that pain, and they're like, oh, there's no other things. Yes, but there is help out there.
Yeah, it is. And like you were saying earlier, the trauma that's associated with it is so, and it's subtle, but it's definitely there. That anxiety that you start to learn to have, but knowing that we do have the pelvic floor physical therapists out there, just try it. That's the worst thing you can do is you go and they say, it actually looks just fine. Maybe you just need to add some lubrication. The best thing that you can find out is I have someone that can help me.
Right. Yeah. And another great thing that we discussed is also about making sure you understand your own body.
Yes.
Yeah. Women, please, let's start looking in between our legs.
Hello. Again, 2 sets of lips. Explore them both. If you can use your chapstick to keep one moist, you can use other methods to keep the other together. So we also, I'm excited about this topic, if you can't tell. So, well, we have some more amazing topics that are coming up over the next couple of weeks as well. On next week, September the 7th, we have From Burnout to Bold Steps with Patrice Brantley. And then on September the 14th, we have Nerves of Steel with Linda Steele. And then on September 28th, we have Relationships, the Power of Presence. September 21st, I have skipped a whole week. We have Why Men Marry the Next Girl, and that'll be with myself as well as Dr. April. So some great shows coming up.
Yes. Well, thank you so much. And if you're out there listening, please follow us or like us on Twitter, Facebook, Instagram, TikTok. And we will see you guys next week. This has been the Bringing Intimacy Back show, where intimacy is real.
Thank you for listening to today's episode of Bringing Intimacy Back, where intimacy is real. You can also find us at bringingintimacyback.com, LinkedIn, Facebook, Instagram, Twitter, and YouTube. Dr. April Brown's 7th book series, Improving Intimacy, is now on Amazon. We'll see you next Thursday at 3:30 p.m. Don't forget to follow, share, and subscribe.